Hi, my name is Muhammad Hafiz Haikal bin Taufik. So this video is about my informative speech. When I was a young boy, I used to see my uncle's eyelid wink when he was eating. At first sight, I was laughing and thought that it was a funny thing. But when I was in secondary school, I also saw the same thing happen to my classmate. So I started researching this little funny thing. I would like to give some explanation about this syndrome so that you all do not feel unfamiliar with this disease and assume that it is just a normal disease and there is no need for us to exclude those who are suffer from this disease. Jaw winking syndrome, or also known as Gunn phenomenon, is a situation where the eyelid will wink if the jaw is moving. This condition usually occurs when the patient chews food and it occurs without control from himself. Causes and treatment for jaw winking syndrome is an important thing that everybody needs to know. First of all, I would like to share with you guys what actually is the main causes for this syndrome. Until today, Gunn phenomenon has no exact cause, but there is an unclear cause that explains why this phenomenon happened. The phenomenon happens because of a rare genetic disorder that exists at the time the baby is born. This rare genetic trait would be a newborn baby even though their parents or their other family members don't have this disease. Jaw winking syndrome can randomly affect anybody. According to Almaby survey in 2019, found that there are a few cases being reported about jaw winking syndrome that involve family genetics. Some cases have been reported that involve familial cases with an irregular autosomal dominant inheritance pattern. In the Medical Archive, a journal of the Academy of Medical Sciences in Bosnia and Herzegovina, it is stated that an 11-year-old boy was taken to their clinic because his parents noticed that his upper eyelid was in a lower position than normal since his early childhood. Even though he was born at 40 weeks of pregnancy and has no history of trauma, still he suffered from jaw winking syndrome. This situation clearly shows that even though that person doesn't have any tragedy happen to them and they was born normally, they still might suffer from jaw winking syndrome. The Gunn phenomenon also happens because of a bad connection of nerve that connect eyelids and jaw. Gunn phenomenon implicate nerve that stimulate the muscles to move has bad connection and affect the eyelid when the jaw is moving. The eyelid wink when the jaw is moving because at the fifth cranial nerve, there is congenital miswiring that affects the nerve that supplies the levator muscle, which is the third cranial nerve. According to VA Sentikuma in 2020, in pathophysiology, jaw winking syndrome is a cykinetic movement that originates from receptors which are proprioceptive receptors of the external pterygoid muscle. For a few patients, this phenomenon was documented between levator palpebrae superior LPS muscles and internal pterygoid. So the Gunn phenomenon is a disease because of rare genetics, or there is a bad connection of nerve that makes your eyelid wink when your jaws are moving, and it can affect anybody randomly. Other than that, it is also important to know about treatment for this syndrome. There is some treatment you can do according to how seriously this jaw winking syndrome affects your life. A treatment that might helping for those who are suffer from this syndrome is through surgical care. The surgeon would recommend an appropriate technique such as removing some part of the levator muscle of the eye without any extensive dissection and not damage to eye or eyelid structures. According to VA Sentikuma in 2020, stated that some surgeons think a child under the age of 1 to 2 years should not have surgery because general anesthesia is safer at 1 to 2 years than infancy. In start pulse and CBI, aggravation of the aberrant eyelid movement may be the result of any surgical correction that aims to repair even only the ptosis without correcting the jaw winking cykinetic move. This situation could be cosmetically disfiguring to the patient. Cosmetically significant for Marcus Gunn phenomenon only if it is 2 mm or more than that. Some surgeons will advise to not proceed with any surgery if the ptosis is mild or if the disease is cosmetically insignificant. Another treatment that may help you to fight this syndrome is you need to do some medical care. If a patient wants to encounter amblyopia, that also known as lazy eye that might affect in loss of vision of the eye, he or she needs an aggressive treatment, and the treatment is with an occlusion therapy. According to VA Sentikuma in 2020, state that this occlusion therapy might with or without correction of anisometropia, and it need to be done before any consideration of ptosis surgery. There is some treatment you can proceed, which is surgical care or medical care, and these treatments should be taken according to how much jaw winking syndrome affect to you, and also some advice that need to be considered as well. I would like to end my speech by saying, jaw winking syndrome might be foreign things to you, but that doesn't mean you don't need to know about the causes, which are from rare genetics or the back connection of the nerve, and also the treatment for this phenomenon, which is through surgery or medical care. Guys, try to think. How are the feelings of those who suffer from this disease? They feel isolated. Are we fair to them? Why do we have to sideline them and assume these are the stuff of jokes? They are also a human being, and a human being needs to be respected and loved by everyone. My name is Hafiz Haikal. Thank you.